The attending surgeon's words cut through the OR like a scalpel. "Get her out. Those hands are too unsteady." Dr. Emma Torres stepped back from the table, face burning. 6 months as a surgical resident, 6 months of being told she wasn't good enough. The other residents exchanged glances, smirks barely concealed. She collected her instruments, headed for the door. That's when the emergency alarm screamed through the hospital. Multi-vehicle collision, mass casualty event, all available surgeons to Trauma Bay 1. Director Phillips burst through the doors, his face ashen. "My son, he was in one of the cars." The patient crashed through minutes later, bleeding out, no other surgeons available, just Emma and her unsteady hands. The trauma bay exploded into chaos, nurses scattered in every direction, equipment carts crashed against walls, someone shouted for O-negative blood. Another voice called for the crash cart. Director Phillips stumbled backward until his spine hit the wall. His legs buckled. He slid down, eyes locked on the gurney being wheeled through the doors. His son, 22 years old, covered in blood. Emma stood frozen 3 feet from the entrance, her hands clenched at her sides, the same hands that had been called too unsteady 30 minutes ago, the same hands that had been dismissed from an appendectomy because they weren't good enough. The lead trauma nurse spun toward the hallway. Her voice cut through the noise. "Morrison. Where's Morrison?" The response came from somewhere near the nurse's station, stuck in traffic. The same pileup. "He's 20 minutes out, maybe more." 20 minutes. The patient didn't have 20 minutes. Phillips lurched forward from the wall. His voice broke. "Someone help him, please. Someone do something." The second trauma attending was elbow deep in another emergency surgery, floor 7, a ruptured spleen that couldn't wait. The third attending was on vacation. The fourth had called in sick. That left Emma. The OZ. Charge nurse Maya turned. Her eyes swept the trauma bay. They landed on Emma. Held there. "You're it. You're all we have." Emma's throat tightened. Before she could move, James stepped between them. Senior resident, 3 years ahead of Emma in the program. His face was flushed, his jaw set. "She can't handle this. We should wait for Morrison." Maya's eyes narrowed. "Wait?" Director Phillips pushed off the wall. He crossed the space in 4 strides. His hands grabbed James by the shoulders. "Wait! My son is bleeding out." The monitors started screaming. The patient's blood pressure dropped, 70/40, then 68/38. A nurse called out from beside the gurney. "We have maybe 8 minutes before he's unsalvageable." 8 minutes. Emma's hands trembled, just slightly. She pressed them against her thighs, forced them still. Maya moved closer. Her eyes studied Emma's face. Something shifted in her expression. Recognition. Understanding. "I've seen your suture work. It's flawless." Emma didn't respond. Maya stepped even closer. Her voice dropped. "Wait, I know you." Emma's jaw tightened. You were deployed, weren't you?" Emma said nothing. Her eyes stayed on the patient, on the blood soaking through the sheets, on the chest that rose and fell too quickly, too shallow. The monitors shrieked louder. Blood pressure 60/35, heart rate 140 and climbing, oxygen saturation dropping, 92%, 90%, 88. James backed away from the gurney. His hands came up, defensive, protective. "I'm not taking responsibility for this." The room tilted. Emma's vision narrowed. Everything fell away except the patient's face. Young. Too young. Dark hair matted with blood, skin going pale, lips losing color. 22, maybe 23 at most, the same age as the soldier in Kabul, the one who bled out while Emma worked on someone else, the one whose face she saw every time she closed her eyes. She couldn't save him, but she could save this one. Her hands stopped shaking. Just like that. Completely still. She'd seen this before, done this before, under worse conditions, with less equipment, with mortar rounds falling 30 meters away. Her voice came out steady, clear. Nothing like the uncertain tone she'd used for 6 months. "Somebody get me a gown, now." Maya moved instantly. She grabbed a surgical gown from the sterile cart, held it open. Emma stepped forward, slid her arms into the sleeves. Maya tied it behind her back. Fast, efficient. Another nurse appeared with gloves. Size 6.5. Emma's size, how did she know? Emma pulled them on, snapped them at the wrists. The monitors continued their terrible symphony. Blood pressure 58/32, heart rate 150, oxygen saturation 85%. Director Phillips stood against the wall again. His face was gray, his hands pressed against his mouth. James hadn't moved. He watched from the corner, his eyes wide. Emma approached the gurney. She looked down at the patient, at Phillips's son, at the massive trauma to his chest, at the blood pooling beneath him. She'd seen worse. She placed her hand on his shoulder just for a second. A promise. "I've got you." Then her hands began to move. Assessment first. Always assessment. She pulled back the sheet. The patient's chest was crushed on the left side. Steering wheel impact. Probable rib fractures, probable pneumothorax, probable hemothorax. Probable didn't matter. She needed to know. Her fingers pressed against his neck. Carotid pulse, weak, thready. But there. Trachea deviated to the right. Confirmed pneumothorax. Breath sounds absent on the left. Confirmed hemothorax. She looked at Maya. Chest tube, 2 units O negative. Prep for emergency thoracotomy. Maya's hands were already moving. She'd anticipated the orders. Good. James stepped forward, his voice uncertain now, questioning. "Are you sure you should—" Emma cut him off, her voice sharp. "Commanding." "Move." He moved. The nurses surrounded the gurney. Scissors appeared. They cut away the patient's shirt, his jeans, everything, exposing the full extent of the injuries. Worse than Emma thought, better than it could have been. Blood pressure 55/30, 6 minutes left, maybe less. Emma positioned herself at the patient's left side. Her hands hovered over his chest, completely steady, not even the slightest tremor. Someone handed her a scalpel. She didn't look up, didn't thank them, just took it. The blade touched skin. Everything else disappeared. There was only the patient, only the injury, only the solution. Her hands knew what to do. They'd done this 43 times before. Under fire, under pressure, under impossible conditions. This wasn't impossible. This was just surgery. The incision opened, clean, precise, perfect. Blood welled up, dark, venous, from the chest cavity, just as she expected. Massive hemothorax, left chest cavity full of blood. She reached for the suction. Maya placed it in her hand before she asked. The blood cleared, slowly, then faster. There, the intercostal vessels, shredded, torn, pumping blood into the chest cavity with every heartbeat. She'd fix that. Her hands moved faster. Clamps, sutures, cautery. The bleeding slowed, then stopped. Blood pressure holding at 55/30, not rising, not falling. She could work with that. Behind her, James whispered something. She didn't hear it, didn't care. Director Phillips made a sound. Halfway between a sob and a prayer, the monitors beeped. Steady now, rhythmic, still critical, but stable. Emma's hands continued their work, precise, calculated, unstoppable. She was back in the field hospital, back where her hands never shook, back where she knew exactly who she was, not the uncertain resident who couldn't hold a scalpel. Captain Emma Torres, combat surgeon, and she was going to save this patient's life. Emma's hands moved through the chest cavity with absolute precision, no hesitation, no uncertainty, no tremor. The intercostal vessels were worse than she'd initially assessed, not just shredded, completely torn, 3 of them, pumping blood with every heartbeat that remained. She clamped the first vessel, tied it off, moved to the second. Her fingers worked faster than thought, muscle memory from 100 similar procedures, 1,000 similar moments. James stood across from her, his eyes locked on her hands, watching them move, watching them not shake. "How are you?" She didn't let him finish. "Suction." There. Maya positioned the suction exactly where Emma needed it. The blood cleared. The field opened. There. The third vessel. Emma's hands closed around it, clamped, tied, secured. The bleeding slowed to a trickle, then stopped completely. Blood pressure, 58/33, holding, not great, but holding. She assessed the chest cavity, looking for additional damage. Her eyes swept across tissue, organs, vessels. The lung was collapsed, expected. She'd already placed the chest tube. It would reinflate once the blood was cleared. But something else caught her attention. The pericardium, bruised, swollen. She touched it gently, felt the fluid beneath, too much fluid. Pericardial effusion, blood collecting around the heart, compressing it, preventing it from beating properly. That explained the low blood pressure. She needed to drain it, now. Her hand extended, palm up, 18-gauge needle, long one. A nurse placed it in her hand. She didn't see who. Didn't matter. She positioned the needle at the correct angle, just below the xiphoid process, 45 degrees, aimed toward the left shoulder. One chance to get this right. She pushed. The needle slid through tissue, through the pericardium, into the pericardial space. Dark blood flowed back through the needle. 60 milliliters, 80, 100. The patient's blood pressure jumped. 62/35, 68/38. Better. Emma withdrew the needle, applied pressure to the insertion site. The monitors continued their steady beeping. Still critical, still dangerous, but improving. She returned her attention to the chest cavity, to the lung, to the torn vessels she'd repaired. Everything looked stable. For now. Then the monitors changed their tone. The steady beep became a scream. Emma's eyes shot to the screen. Flat line. The patient's heart had stopped. Blood pressure 0, heart rate 0, oxygen saturation plummeting. Her hands were already moving, charging to 200. Clear. The nurses pulled back. Emma placed the paddles on the patient's chest, delivered the shock. The body convulsed. Then went still. Nothing. The flat line continued. Emma dropped the paddles. Her hands plunged into the open chest cavity, found the heart, grasped it, direct cardiac massage. Her fingers compressed the heart muscle, squeezed, released, squeezed, released. 1 compression per second, forcing blood through the body, forcing oxygen to the brain. 10 seconds, 20, 30. Her hands kept moving, steady, rhythmic, perfect. She'd done this before, in a tent hospital outside Fallujah, with a 19-year-old private whose heart had stopped from blood loss. She'd massaged his heart for 90 seconds before it started again. He lived. This patient would live too. 40 seconds, 50, 60. Her hands never faltered, never slowed. The muscle memory so deep she could do this in her sleep. Maya's voice cut through the tension. Again, 300, clear. Emma pulled her hands out. The paddles came down. The shock delivered. The body convulsed again. Then, a beep. 1 single beep from the monitor. Then another. Then a rhythm. The heart was beating. Blood pressure returned. 50/30. Then 60/35. Then 70/40. Rising. Emma's hands went back into the chest, checking, assessing, making sure the vessels hadn't torn open again from the defibrillation. Everything held. The sutures were perfect, the repairs intact. James hadn't moved. His voice came out barely above a whisper. "Where did you learn to do this?" Emma didn't look up. Her hands continued working, inspecting every millimeter of tissue. Fallujah, Kandahar, Mosul. Her voice was flat, clinical, detached, field hospital. No equipment, no backup. Just hands. She found a small bleeder, cauterized it, moved on. "I've done this exact procedure 43 times under mortar fire." The room had gone silent except for the monitors. Everyone watching, everyone listening. Blood pressure 80/50, climbing steadily. Then she saw it. The pulmonary artery, a small tear, barely visible but growing. Blood seeping through with each heartbeat. If she didn't fix it, the patient would bleed out in minutes. Her hands moved faster. Suture, 4-O-proline. The needle appeared in her hand. She threaded it through the torn vessel wall. Once, twice, 3 times, tied it off. The bleeding stopped. James was still staring, his face pale, with worse injuries, with less time. Her voice carried no pride, no boasting, just fact. She'd operated on soldiers with limbs blown off, with abdominal organs exposed, with skull fractures and brain injuries, in tents that shook from nearby explosions, with supplies running out, with generators failing. This was a controlled environment, clean, sterile, well-lit, all the equipment she needed. This was easy. Her hands completed the final repairs, checked everything one more time, then withdrew from the chest cavity. The monitors sang their improving song. Blood pressure 90/55, then 100/60, then 110/65. Holding there, stable. Emma stepped back from the table. Her gown was covered in blood, her gloves slick with it, but her hands were steady, perfectly steady. She stripped the gloves off, dropped them in the biohazard bin. Her hands still didn't shake. Not even a tremor. She looked at Maya. "He'll need post-op monitoring. Watch for pneumothorax recurrence and keep an eye on the pericardium. If the effusion returns, page me immediately." Maya nodded, her eyes bright. Impressed. Emma turned to face the room. Everyone was staring at her. The nurses, the techs, James. Director Phillips stood against the wall, his face wet with tears, his mouth open, speechless. Emma met his eyes, held them for a moment. Your son is stable. He'll be in the ICU for at least 48 hours, but he's going to survive. Phillips couldn't speak. He just nodded. His hand pressed against his chest. Emma stripped off her gown, dropped it in the laundry bin. Her scrubs underneath were mostly clean. A few spots of blood. Nothing major. She walked toward the door, her legs steady, her breathing even. Behind her, James finally found his voice. That was impossible. Emma paused at the doorway, didn't turn around. No, that was necessary. Then she walked out. Her hands still didn't shake. Not yet. That would come. Later. When she was alone. When the adrenaline faded. When she remembered all the soldiers she couldn't save. But right now, in this moment, her hands were exactly what they needed to be. Perfect, steady, unshakable. The hands of a surgeon who had seen hell and learned to operate there. Who had lost patients and carried their faces with her. Who had been broken and rebuilt herself into something harder, something stronger, something that didn't shake when it mattered most. Emma disappeared into the hallway. The trauma bay fell silent behind her. The monitors continued their steady rhythm. The patient's chest rose and fell, regular, strong, alive, because of hands that were supposedly too unsteady, because of a surgeon everyone had dismissed, because sometimes the people you overlook are exactly the ones you need. The post-op area was empty when Emma entered. She went straight to the sink, turned the water on, let it run hot, then hotter. Her hands went under the stream. The blood washed away, swirling pink down the drain. She scrubbed between her fingers, under her nails, along her wrists. The water scalded her skin. She didn't adjust the temperature. She looked up at the mirror, at her reflection, at the face staring back at her. Something had cracked open, something she'd kept locked away for 18 months, since the day she left the military, since the day she decided Captain Emma Torres was dead. Her left hand started to shake. Just slightly at first, a tremor in her fingers, then her whole hand, then up into her wrist. She gripped the edge of the sink, forced it to stop, squeezed until her knuckles went white. The tremor fought back, stronger now, insistent. She closed her eyes, breathed, counted to 10. When she opened them again, her hand was still, but she could feel it, just beneath the surface, waiting. The door opened behind her. Emma didn't turn. She knew who it was. She'd seen the recognition in Maya's eyes during the surgery. The moment, the older nurse had put the pieces together. Maya closed the door. The lock clicked. I did recognize you, Captain Emma Torres. You were decorated. Emma's jaw tightened. She kept her eyes on the sink, on the water still running. That was someone else. Maya moved closer. Her voice was gentle, careful. The news said you saved 17 soldiers in a field hospital under siege. Emma's hands gripped the sink harder. I lost 3. Her voice broke on the number, that single syllable that carried the weight of everything. The 3 faces she saw every time she closed her eyes, the 3 names she whispered before she fell asleep, the 3 failures that defined her more than the 17 successes. Maya waited. She didn't push, didn't ask questions, just stood there, patient, understanding. Emma finally spoke, the words coming slowly at first, then faster, like a dam breaking. Last deployment, Kabul, emergency evac hospital. She turned off the water, dried her hands on a paper towel. Still, didn't look at Maya. They brought in casualties from an IED, 22 soldiers, overwhelming trauma. The memories flooded back, the ones she'd been fighting for 18 months, the sound of the helicopters, the smell of blood and burned flesh, the screaming. Always the screaming. I triaged, I chose, I operated for 14 hours straight. Her voice went flat, clinical. The only way she could tell this story without falling apart. 17 lived, 3 didn't, because I wasn't fast enough, wasn't good enough. The tremor returned to her left hand. Worse now, visible. She shoved her hand in her pocket. One of them was 22, same age as Phillips's son. She finally turned to face Maya. Her eyes were dry. She'd cried all her tears months ago. There were none left. When I came back, I couldn't hold a scalpel without seeing their faces. Maya's expression didn't change. She just listened. Let Emma speak. The tremor started. Psychosomatic. The attending physician said I was damaged. The word hung in the air. Damaged, like she was broken equipment. Something that couldn't be fixed, something that should be discarded. So I left. Retrained. Started over as a civilian resident. Emma pulled her hand from her pocket, looked at it, at the tremor that had defined her for 18 months, at the physical manifestation of her guilt. Thought maybe if I was just ordinary, I could forget. Maya stepped forward, placed her hand on Emma's shoulder. The touch was warm, solid, real. You saved that boy's life today. Emma's voice came out hollow, empty. I should have been able to save all of them. The door opened again. Both women turned. Director Phillips stood in the doorway. His eyes were red, swollen from crying. Behind him stood two other men, Dr. Morrison, the lead attending, the one who had kicked Emma out of surgery 3 hours ago, and the chief of surgery, Dr. Ashford, the man who ran the entire trauma program. Phillips stepped inside. His voice was thick with emotion. My son is alive because of you. Emma nodded once. Professional, detached. I'm glad I could help. Morrison moved forward. His face was unreadable. Emma had spent 6 months trying to earn this man's approval. 6 months of being told she wasn't good enough, wasn't ready, wasn't capable. I need to speak with Dr. Torres. Alone. Maya squeezed Emma's shoulder once, then left. Phillips followed her. The chief of surgery remained in the doorway for a moment, his eyes on Emma, assessing. Then he too stepped out. The door closed. Morrison didn't speak immediately. He stood there, looking at Emma, at her hands, at the tremor that had returned the moment the adrenaline faded. A long silence stretched between them. Finally, Morrison spoke. I didn't know about your background. Emma's voice came out quiet, steady. You didn't ask. The words hung there. An accusation without being accusatory, a simple statement of fact. Morrison's jaw tightened. He looked away, then back. Those tremors, I observed. He gestured at her hand. Only happen outside the OR. Only when it doesn't matter. Emma's voice was firmer now, more certain. Morrison processed this. She could see him working through it, his dismissal of her, his arrogance, his absolute certainty that she was incapable. All of it wrong. He took a breath, let it out slowly. I owe you an apology. We all do. Emma said nothing, just waited. The way we've treated you, the way I questioned your abilities today. He paused, struggling with the words. You're one of the most skilled surgeons I've ever seen. And I almost let a patient die because I was too blind to see it. Emma's hand clenched. The tremor intensified for a moment, then stopped. Morrison noticed. Understanding dawned in his eyes. It's not about capability. It's about trauma. Emma nodded. Once. He moved toward the door, opened it, then turned back. The chief wants to speak with you. About your future here. He paused. I'll be recommending we promote you to chief resident. Effective. Immediately. Emma's eyes widened slightly. Chief resident. The position she'd been told she'd never be ready for. The position James had been grooming for. The position she'd stopped hoping for months ago. Morrison's hand was on the door handle, but he didn't leave. Not yet. For what it's worth. What you did today, that wasn't just surgery. That was art. He left. Emma stood alone in the post-op area. The fluorescent lights hummed overhead. The sink dripped. Somewhere down the hall, a monitor beeped. She looked at her hands, both of them now. The tremor was there, persistent, visible. But in the OR, it disappeared, completely, like it had never existed. Her hands knew the truth even when her mind didn't. In the moments that mattered, in the situations where lives hung in the balance, in the chaos and blood and impossible decisions, her hands were steady, perfect, unshakable. Everything else was just noise, just guilt, just the weight of 3 names she'd carry forever. But that weight didn't make her incapable. It made her better, more careful, more determined, more willing to fight for every single life that came through those doors. She dried her hands again, straightened her scrubs, took a breath, then walked out to face whatever came next. because Captain Emma Torres might be dead. But Dr. Emma Torres was just beginning. 1 week later, Emma sat in the chief of surgery's office. Her hands rested in her lap, completely steady, not even the slightest tremor. Dr. Ashford sat across from her, his fingers steepled, his expression thoughtful. "We're creating a new trauma fellowship position. We want you to lead it." Emma blinked, processed the words. Fellowship director. That was an attending position, reserved for surgeons with years of experience, established reputations, proven track records, not as a resident, as an attending, effective immediately. The words didn't make sense. She'd been a resident for 6 months. Chief resident was already beyond her expectations. But attending? What about my tremor? The question came out before she could stop it. The vulnerability she'd spent months hiding, now laid bare. Ashford leaned forward, his eyes locked on hers. "What tremor?" "I've reviewed your surgical records, every single procedure. Flawless." He gestured at her hands. "Your hands only shake when you're trying to hide who you really are." The truth of it hit her. Simple. Undeniable. Her hands only trembled when she was pretending to be someone she wasn't, when she was trying to be ordinary, when she was denying everything she'd learned, everything she'd become. Emma took a breath. Let it out slowly. "I accept." 3 weeks after that conversation, Emma stood in operating room 2 wearing surgical greens with an attending badge clipped to her chest. Around her stood 5 new residents, first year, fresh out of medical school, nervous, uncertain, just like she'd been 6 months ago. One of them, a young woman named Dr. Patel, had hands that shook slightly as she held a scalpel. Emma watched her, recognized the fear, the doubt. It's okay to be afraid. Fear means you understand the stakes. Patel looked up, her eyes wide. But when you step to that table, you leave it outside. The patient needs your certainty. Emma took the scalpel from Patel's trembling hand, demonstrated the proper grip, the correct angle. Her own hands rock solid, perfect, like this, confident, deliberate. The scalpel is an extension of your hand, not a separate tool. She handed it back. Patel's grip was steadier now, not perfect, but better. Emma smiled, small, encouraging. "You'll get there. Trust yourself." 2 days later, Emma walked through the recovery ward doing post-op rounds. She turned a corner and stopped. Phillips's son stood in the hallway, walking slowly, carefully, one hand on the wall for support, but walking, alive. He saw her. His face brightened. He extended his hand. "They told me you're the one who saved me." Emma shook his hand. Her grip, firm. No tremor. "You were the only one who could." His words echoed something she'd heard before, in another hospital, in another life. From a soldier she'd managed to save despite impossible odds. Emma held his gaze. Something shifted in her chest. The weight she'd carried for 18 months, still there. But different now, not crushing, just present. "You remind me of someone I knew once." She said it quietly, thinking of the 3 she'd lost, the faces that still visited her dreams, the names she still whispered. But for the first time, she could think of them without drowning in guilt, could remember them without forgetting the 17 she'd saved, could carry their memory without letting it destroy her. Phillips's son smiled, released her hand. "Thank you. For everything." Emma nodded, watched him walk away, his steps growing steadier with each day, just like hers. 6 months passed. Emma's trauma fellowship program had grown beyond anyone's expectations. 15 new surgeons, trained. Graduates placed in hospitals across the country. But what made the program unique was its focus. Veterans transitioning to civilian medicine, soldiers who'd served as combat medics, as field surgeons, as emergency responders in war zones, people whose hands knew trauma, who'd operated under fire, who carried the same weight Emma carried. She gave them a place where that weight was understood, where their trauma wasn't a disqualification, where their past made them better, not broken. James worked under her now, the senior resident who'd questioned her abilities, who'd said she couldn't handle the pressure, who'd backed away when it mattered most. He'd apologized, multiple times, then asked to join her program, to learn from her. She'd said yes. Because everyone deserved a second chance, everyone deserved to grow beyond their mistakes. On a Tuesday afternoon, Emma stood in operating room 2 again. A complex trauma case, multi-vehicle collision, chest trauma, abdominal. Injuries, the kind of case that required absolute precision. Her hands moved through the procedure with practiced ease, every suture perfect, every incision exact, every decision immediate and correct. Around her, residents watched, learning, absorbing. She spoke as she worked, teaching through demonstration. Your past doesn't disqualify you, it prepares you. Her hands continued their perfect rhythm. Everything you've survived, everything you've endured, everything you've learned from your failures, it all matters. It all makes you better. She tied off the final suture, checked her work. Flawless. The patient's vitals climbed, stabilized, another life saved. Emma stepped back from the table, stripped off her gloves, her hands perfectly steady. She looked at the residents, at their faces, at the hope and determination she saw there. This was why she'd survived, why she'd been given a second chance, not just to save lives, but to teach others how to save them too. Sometimes the people we overlook are the ones most capable of saving us. The hands that shake in peacetime may be the steadiest when everything falls apart. True expertise doesn't announce itself. It shows up when it matters most. Never judge someone's abilities by their trauma. The ones who've been through the fire are often the best equipped to pull others out. Emma had been through the fire, had lost people she couldn't save, had carried guilt that nearly destroyed her. But that fire had forged her into something stronger, something better, something that could stand in an operating room and save lives that others said were unsavable. Her tremor would probably never fully disappear. It would always return in quiet moments, when she was alone, when she remembered. But in the moments that mattered, in the chaos and blood and impossible decisions, her hands would always be steady, always be ready, always be exactly what they needed to be. What would you have done in Emma's position? Share your thoughts in the comments. If this story moved you, subscribe for more inspiring emergency hero stories. Know someone who needs to hear this today? Share it with them.